Cranial nerve 1, olfactory. First, number the sense and have the client identify it. Remember to use sense that do not have a lingering effect. Ask the client to close their eyes so they do not get any visual cues.
Mylene, please close your eyes.
Occlude the left nostril and then present a smell specimen to the right nostril, asking the client to inform you when they are able to detect its smell.
Please tell me what you can smell.
Lemon.
Repeat this step with the right nostril occluded and with both nostrils unoccluded.
Please tell me what you can smell.
Vanilla.
Tell me what this smell is.
Coffee.
The client was able to identify lemon, vanilla, and coffee, so this cranial nerve is intact.
Cranial nerve 2, optic. For this cranial nerve, you are going to do two tests. First, we are going to test the peripheral vision by doing the confrontation visual field test. To do that, first, have the client stand in front of you about an arm's length away. Ask the client to cover up her left eye while the nurse will cover her right eye.
Mylene, please cover your left eye.
Instruct the client to look at the left eye of the nurse.
I want you to look at this eye only and do not follow my fingers. But later, you will tell me how many fingers will you see.
Ask the client to tell how many fingers he or she can see in both upper and lower visual fields.
Please tell me how many fingers? 2. What about this?
3.
Repeat the process on the right eye.
Okay, now let us cover your right eye. We will do the same process. Tell me how many fingers you see.
2. 3.
Second thing you will do is to test visual acuity using a Snellen's chart. First, have your client stand 20 feet from the chart.
Mylene, I want you to stand right here and then look at the chart in front of you.
Ask your client if they are wearing glasses or contact lenses.
Are you wearing glasses or contact lenses?
If your patient is wearing glasses or contact lenses, then have them wear those for this test. Instruct client to cover one eye and to identify a line on the chart that he or she can comfortably read.
I want you to cover your left eye and then focus on the chart and then identify a line in the chart for which you are comfortable reading.
Ask the client to read the letters on that line aloud.
Okay, have you identified a line?
Yes, it's number 8.
Okay, so I want you to read aloud the letters that you can see.
D, E, F, P, O, T, E, C.
Do these steps first on the right eye, then left eye, then both eyes.
That's good. Now, we will proceed with your other eye, okay? So I want you to cover your right eye and do the same process.
It's in number 8. D, E, F, P, O, T, E, C.
Great. Now, we will do both eyes.
It's in number 9.
Mm-hmm.
L, E, F, O, D, P, C, T.
Record client's visual acuity for each eye by noting the line for which the client correctly identified either A. More than half the letters on that line but not all of them, or B. All letters on that line plus a few letters less than half on the next line. Client was able to read from line A, which means she has 20/20 vision, meaning Mylene can see the same line of letters at 20 feet that a person with normal vision can see at 20 feet. Cranial nerve 4, trochlear, and cranial nerve 6, abducens. The first thing you will do is to look for any involuntary eye movements that can occur from side to side, up and down, or in a circular pattern. This condition is known as nystagmus. First, take your pen light and hold it 12 to 14 inches away from client's nose. Instruct client not to move his or her head and to use eyes to watch where the pen light is.
Mylene, I want you to keep your head still and I want you to focus on the tip of the pen light that I am holding.
And as you are doing this, you are to move your pen light according to the 6 cardinal fields of gaze and try to observe for nystagmus.
Now, I want you to follow the tip of the pen light as I move it along with your gaze.
Next, we are going to see how reactive are the pupils to light. First, dim the lights a little bit. Ask the client to look ahead at a specific point to help dilate the pupils.
Mom, I want you to focus your gaze at the wall behind me.
Shine pen light to client's left eye. When you do this, you need to be looking at the left eye and making sure the pupil constricts in response to the light. Shine your light back into the left eye again, but this time you need to look at the right eye and make sure that the pupil on the right also constricts when you shine light into the left pupil. Repeat these steps on the right eye. Then, we are going to test for the accommodation reflex. First, turn the lights back on. Ask the client to focus on a distant object to help dilate the pupils.
Mylene, I want you to focus on the wall behind me.
Instruct client not to move his or her head and just follow the pen light or the tip of the index finger.
Keep your head still and I want you to follow the tip of my index finger.
Use the pen light or the tip of the index finger and slowly move it towards the tip of the patient's nose. Watch the client's pupil to make sure you see them constrict, accommodate, and eyes cross as your pen light or fingertips gets closer. We can now document that the pupils are equally round and reactive to light and accommodation. Cranial nerve 5, trigeminal. To examine the corneal reflex, first, ask the client to look upward.
Mylene, I want you to look upward.
Lightly touch a sterile wisp of cotton against the temporal surface of each cornea. Confirm that both eyes blink when either cornea is touched. A blink and tearing is a normal response. Cranial nerve 5, trigeminal. To examine the corneal reflex, first, ask the client to look upward.
Mylene, I want you to look upward.
Lightly touch a sterile wisp of cotton against the temporal surface of each cornea. Confirm that both eyes blink when either cornea is touched. A blink and tearing is a normal response. This is how to examine facial sensation.
Mylene, I want you to close your eyes. Keep it closed until I tell you when it is okay to open it. I will be touching your face with an object, and I want you to tell me if you can feel the object on one side or on both sides of your face.
One side. Both side. One side.
And now, I want you to tell me if you can feel the same sensation on both sides of your face.
The same. The same. The same.
And then, I want you to tell me if the sensation that you feel is a sharp sensation or a dull sensation.
Sharp. Dull. Sharp. Dull.
To test for mastication,
Mylene, I want you to clench your jaw and move it side to side. Okay? Clench your jaw and move it again side to side. Now, I want you to open your mouth .
cranial nerve 7, facial.
Mylene, I want you to close your eyes and then smile, frown, wrinkle your forehead, and puff out your cheeks.
Observe for symmetry while the client performs facial movements. Next is to identify areas of taste. First, ask client to identify various tastes placed on tip and side of tongue.
Mylene, I want you to close your eyes and then I will be giving you something to taste. You will tell me what is the taste. Let us begin now. Kindly open your mouth and tongue out. Kindly identify the taste.
Sweet.
Water may be needed to rinse the mouth between tests.
I'll be giving you some water. Keep your eyes closed. You may drink. Okay. We will now proceed with the second one. So please open your mouth again. And then tell me, what is the taste?
Salty.
Okay. I'll be giving you water to drink. Here it is. And the last one, please open your mouth again.
Sour.
Here is the water. Okay, you may open your eyes.
Cranial nerve 8, auditory, voice whisper test. Ask the client to occlude one of his ears. Cover your mouth so that the client cannot see your lips whisper a simple phrase. Have the client repeat the whispered words.
Mylene, I want you to cover your right ear with your fingers. 1, 2, 3. Please repeat what you have heard.
1, 2, 3.
Okay, you may remove your fingers from your ears.
Repeat test with the other ear using a different sentence, number, or letter combination. If necessary, gradually increase voice intensity until the client correctly repeats what was whispered.
Okay, we will now proceed with your other ear. So please use your fingers again to cover your left ear. A, B, C. Please repeat what you have heard.
A, B, C.
Okay, you may remove your fingers from your ears.
Weber's test for lateralization or unilateral hearing loss. Hold the tuning fork at its base and tap it lightly against heel palm. Place vibrating fork on top of head at the midline. Ask the client if the sound is heard better in one ear or the same in both ears.
Mylene, can you hear clearly on both ears?
Yes.
Ryan's test. This helps distinguish whether the client hears better by air or bone conduction.
Mylene, I will be placing my tuning fork at the back of your ears, and then you will thumbs up if you can no longer hear the sound. Is that okay with you?
Yes.
Let us begin.
Cranial nerve 9, Glossopharyngeal, and cranial nerve 10, Vagus. Test for gag reflex. Depress a tongue blade on posterior tongue or stimulate posterior pharynx to elicit gag reflex.
Mylene, I want you to open your mouth. Okay? And then, I will put something on your tongue. Alright? I will do it now.
Have client say ah. Observe for symmetric rise of ovula and soft palate.
Open your mouth again. Tongue out. And then, say ah.
Ah.
Cranial nerve 11, spinal accessory.
Mylene, I want you to follow what I will be doing. Turn your head to the side, center, to the other side, back to the center. Okay. Now, you will touch your ears to your shoulders without lifting your shoulders. Back to the center, and then to the other side. Alright. I will be placing my hands against your cheeks, and then you will turn your head against the palm of my hand. Let us begin. Okay, on the other side. Okay. Now, I will put my hands against your shoulder, then you will lift your shoulders up against my hands.
Cranial nerve 12, hypoglossal. Ask client to protrude the tongue at midline, then retract. Then move it side to side against the side of the cheek with the tongue.
Miley, I want you to open your mouth, tongue out, okay? Retract your tongue slowly, and then move it side to side. Now, I want you to move your tongue side to side against my fingers.
I did so.
Ay, wala.